Some.
Hey everyone, Debbie Jones here with the Thomson-McDuffie Chamber of Commerce, and we're so glad you're joining us today for our very first Chamber Connect show. This program is just another way we can get you up-to-date information on what is happening in our community. If you've got questions you'd like to ask our presenters, just post it in the comments below, and we'll do our best to get them answered, provided that we have time. If you want to just show your appreciation for any of them, then you can do that as well. But before we get started, if you look at the top right corner, you'll notice our sponsors for today's show, University Hospital McDuffie. They are our top level sponsors for our chamber, and we are so thankful to have them involved, not only in the chamber, but the community as well. And we're very fortunate as a rural community to have a local hospital with state-of-the-art technology and expertise. So on with our program, I'd like to introduce our guest today, Kathy Linebarger, family nurse practitioner and at the health department. Bob Kepshire, he is a hospital administrator at University Hospital McDuffie. And then we've got Dr. Rolando Torres, who is the director of emergency medicine at both University Hospital McDuffie and Somerville. So thank y'all for joining us today.
Thank you, Debbie. Glad to be with you.
All right. So we're going to go ahead and jump right in. And I'm going to go ahead and give this question to Bob Kepshire. Right now, with the cases going up all around, can you give us an up-to-date case here in McDuffie County?
Well, actually, I don't have the most up-to-date numbers for the county in general. I looked to the state site this morning, and it's cumulative numbers. So I can tell you, since the state's been tracking the numbers, we've had a total of 206 confirmed cases, and these are residents of McDuffie County. That represents about 1% of the population. The state has the county is being populated, a population of 21,597 people. Of those 206 confirmed cases, we've had 8 deaths, which represents 3.9% of the confirmed cases. And so far, since we've been keeping track of these statistics, there's been a total of 39 patients who have been hospitalized with COVID. I can tell you that we have had a surge in the CSRA, and currently within the University Healthcare System, we have 1 patient hospitalized here at University McDuffie with COVID. That patient is in a negative pressure room, which protects the other folks on the floor. Everything's safe here at the hospital. But between our main campus and predominantly our Somerville campus, that's where we're really cohorting the patients that are positive for COVID. There's 95 patients currently hospitalized. There are 12 patients currently under investigation for COVID. So that means there's a high suspicion that they have COVID and they've been tested, and we're waiting for those test results. And we currently have 15 patients that are positive for COVID that are in our intensive care unit.
Okay, so I'm going to go ahead and swing this question over to Dr. Torres with the current spike. Do you think it's because of the increased testing, or is there something else that's causing for us to know that there's a higher level of spike in our area?
Actually, it's both. We have repped up our testing, the whole state has, as it become more available to the general public. But the spike in admission is not due to testing, it's because we are seeing sick folks with COVID, and they're needing admission. They meet certain criteria such as lack of oxygen, unstable vital signs, difficulty breathing. Those are being admitted to the hospital because they need the hospital support to improve. And that spike is what really surprised us over the last 2 weeks.
Okay, all right. So, Kathy, I see you down there, and I know that we just talked about the hospital. Can you give us an update on what's happening at the health department?
Our focus has been ramped up to include more testing and case surveillance. So we're not doing as many for the amount of service that we usually do, but we are doing more testing.
Okay. So, Kathy, let me go a little deeper on that. As far as what are you what are the people at the health department, your staff, what are they doing to kind of, when a visitor comes to the health department, they think they may have COVID or just curious, what's the proper protocol?
If there's someone presenting that they think they have COVID, then we encourage them to leave because we can't have anyone active in the building. And we encourage, use the face mask. We wear face masks. And then we set them up with a testing site at the closest and most convenient for them.
Okay. All right, Bob, back to you.
Okay.
All right. So we just talked about, visitors going to the health department. So tell us about what visitors can expect from the hospital.
Well, because of the current surge in hospitalizations and just what we're experiencing, we've gone back to restricting visitors so that no visitors are allowed to accompany a patient. We're doing this. I know it can be very frustrating and stressful for family members, but we're doing this to protect the other patients as well as our staff. We do have some exceptions to that visitation policy. They're handled on a case-by-case basis. So depending on a need of a particular patient, we'll discuss that with the physician and the patient and their family member or caregiver. May make some exceptions, but predominantly no visitors. So that's kind of upfront, and that's what we're doing right now. That can change depending on what happens with the numbers in the area, but again, because of the surge. For all visitors, or rather patients that are coming in, say for an emergency department visit or outpatient testing or procedure, everyone's restricted to come into the hospital through the emergency department walk-in entrance. At that point, we have personnel there that'll greet the individual. If they're not already wearing a mask, we will provide a mask to them. Their temperature is scanned to see if they're running a fever. We'll ask a question: have you been diagnosed with COVID? So there's some people that already know that they're COVID, but they may be coming to the hospital. And then we'll get that patient directed to the department where they need to go. They'll also be given a badge that'll actually say visitor, and it's marked with the date. That way, we know that they've been checked for that date to come into the hospital.
Oh, thank you, Bob.
You're welcome.
All right, so Dr. Torres, if you've tested negative, should you still quarantine?
If you were concerned enough to be tested, just out of curiosity, or you just wanted a peace of mind, and you are negative without any symptoms, I will say social distancing is still the smart thing to do. Wash your hands and wear a mask in public, and have others do the same around you. Now, within your household, if you have no symptoms and you tested negative, you can still interact like you usually do. However, if you're tested negative and you have symptoms, it could be just as well the flu, it could be just a common cold. But I would definitely practice more social distancing, even from my own family. I would wash my hands, interact with them, keeping a safe distance until my symptoms are resolved, even with a negative test.
Thank you, Dr. Torres. Kathy, so say somebody does get a test, positive or negative. From a business standpoint, from an employer, what would you suggest that employer do if they have an employee that goes and gets tested?
If they go in and get tested, they've been exposed, then they should be quarantined. If they've not been exposed to anyone and they're not getting any symptoms, and they're just getting tested out of curiosity, it would still be up to the employer. We can recommend, we can tell them the recommendations, but ultimately it's up to the employer how they handle that situation.
Okay, so you're saying, you're giving the employer that decision, but there's no actual protocol.
Well, there is a protocol. I mean, if you've been exposed to someone, then you should quarantine for 14 days. Then if you decide that you want to get tested, then depending on at that point, how close when was the last exposure? You can take up to 2 to 5 days before you can sit with symptoms. So up to 14 days. So if you get tested too quickly, you can get a false negative. And so you don't want to get tested too quickly.
All right. I think that'll clear that up. Okay, so Bob, let's talk about people that are getting elective surgeries. Can you let us know what's happening with that?
Well, we're still doing elective surgeries here at University Hospital McDuffie. Early on during the spring, we did put a moratorium on doing elective cases just because of the unknowns. So we have started doing cases again. That started in mid-May. We do have a whole protocol in place for any patient who may require intubation. So say, if you're coming in for general surgery and the anesthesiologist has to put a tube into your windpipes to be able to give you anesthetic, or any patient who's having a procedure that has to do with the GI tract, so say a colonoscopy. Just because COVID is highly transmittable by either aerosol or the GI tract, we require that a patient have a COVID screening for those procedures. And when they're working with their surgeon, the surgeon will discuss that with the patient. The surgeon will order the COVID screen. Our prompt care, predominantly at the Grovetown location, will contact the patient with the date and time for them to come to prompt care to have the screening done. For other procedures that do not require intubation or a non-GI procedure, patients can come in. There's not a requirement to be pre-screened. They will be required to wear a mask in the hospital during the procedure. And our operating room has been quite busy since we restarted doing elective cases in mid-May. Also, all of our outpatient services are open, so folks can come into the lab for lab draws. Radiology services are open, so general X-rays, CT scans, ultrasound, echocardiograms, bone density, mammograms. We're doing all those. Again, the patient will be screened at the door. The requirement is that they wear a mask the whole time they're here. And right now, it's pretty much business as usual here at the hospital, and we're actually seeing our numbers kind of get back to where we were before this kind of all hit us in the early spring.
Okay. Sorry there. Let me get everybody back to the window here. So sounds like it's back business as usual, right, Bob? Except we just got a few limitations.
Few limitations with visitors and just the heightened awareness. Staff all have to be screened when they come into the building as well. So staff are limited to coming into one entrance. They get their temperature taken. We all wear masks. Of course, in my office, I don't wear a mask, but if I'm meeting with other people or anywhere else in the hospital, I'm wearing masks. The staff, I just want everyone to know it's very safe to be at the hospital. The nurses and the physicians and all the technicians are taking the proper precautions with masks, any other type of personal protective equipment they may need. And we're doing very diligent hand sanitation here as well, which we always do. But I think there's a heightened awareness about it anyway right now because of COVID.
Okay. So Dr. Torres, on the positive COVID cases that are coming through the ER, what kind of symptoms are you seeing with that?
One of the interesting things about COVID is how many ways it can present itself. We're starting to see some certain trends with our older individuals. We're seeing more respiratory symptoms, more of the coughing, the shortness of breath, the low oxygen levels. But we're also seeing them come back with diarrhea, which was a surprise. And it's usually the younger individuals, the ones between 18 and 40 years of age. And that may be the only symptom. One of the early symptoms that have pretty much become a trend with this COVID is loss of smell and taste. If you have loss of smell and taste suddenly, and you notice that you're not tasting food the right way, that may be just the initial symptom, and it may be the only symptom you have.
Okay. On those cases that come through, on average, how many do you think are coming through like on a daily basis? Positive cases.
From those that we test, we probably see 6 to 10 patients a day. Those that are being admitted, maybe 2 to 3, depending on age, what underlying medical problems they have, and how they present themselves. We have admitted young 30-year-old that have significant disease with shortness of breath and low oxygen. And we've had 80-year-olds that have a mild cough. Their chest x-ray may show a similar pattern that COVID, and they do well. This disease is completely unpredictable. We know a lot about the flu because we've been dealing with the flu for 100 years. This is significantly different. So we're learning, and we're coping pretty well because we are admitting the right folks, and we are sending home others to be quarantined in their own homes, and they do well.
That still is an alarming number to know daily that's how many positive cases are coming through. Kathy, so can we talk a little bit about the testing sites and where people can go get tested?
Okay. At this point, we're past it. We were at Sweetwater, and we have left that site, and now we're doing mobile sites. Like this Friday, we'll be at the Housing Authority. Next Friday, we may be back in Deering. We're just kind of hopping around trying to meet the needs of the community. So different places, different. But as always, we test on Fridays. The McDuffie County Health Department, their day is Friday, and then each health department in our district, 13 of us, are testing at least one day a week. But depending on where you live, you can find someone that is testing. And our tests are free.
Okay, great. That was another question I was going to ask. So time-wise, for somebody to get there, give us a time of when they would need to be there.
We're doing it from 9 to 11. We have to cut hours back because the temperatures outside are getting very hot, and the PPE that we have to wear is very warm.
I understand.
And it's all through drive-through. There's no, a drive-through. They stay in their vehicle, and we walk to them, test them, and they drive off.
So when people are coming to the testing sites, are you seeing a long line, or how is it kind of hit or miss?
It comes in little spurts, but it's pretty much a steady stream now that we've cut our hours back. When we had longer hours, it was kind of more spread out. But now that we've condensed it to 2 hours, it's pretty much one right after the other.
Okay. All right. So Bob, we're back to you. And we know that social distancing can delay the pandemic, right? In your opinion, should we postpone and cancel events in our community, say like festivals and things like that? Because we've got a lot of things on the horizon. So what would you suggest?
Oh, I hate to be the bearer of bad news, but I think that folks need to really take this seriously. I've heard comments like I still hear people saying, this is a hoax. This is being done to focus on a particular political party. This is the government doing stuff. All kind of crazy things.
The week chart times too.
This is really something to be taken seriously. Just looking at how many people are being hospitalized. We're seeing the surge here, but you see on the news some of the other states that are really out of control. Texas has a major issue. Arizona, Florida, who's just to the south of us, is really having issues, and really issues with bed capacity, especially intensive care beds. So it is really something to be concerned about. I think people sometimes get a false sense of security. Well, if I'm outside, the virus isn't going to spread. Well, if you're in a crowded location and people are sneezing, coughing, talking, and you're right there next to each other, you could still spread this virus. It needs to be taken seriously. Many times too, when you're out at a festival or other places, do you really think about sanitizing and washing your hands the way you should? So I would say it depends on the venue and the circumstance. But even then, you still have to social distance. And I think Dr. Torres had mentioned that, wearing the mask. you're protecting the person next to you. And I think if everybody took responsibility for their neighbor or their family member by wearing a mask, studies have shown a double layered cloth mask goes a long way of keeping the aerosolization that comes from our mouths at a relatively close distance, or not a very far, doesn't go very far away from you. And, you know, not having a mask on and coughing and sneezing, that aerosolizes it, it just travels everywhere, and the wind can pick it up. So if you're in a crowded area, it gets spread. So I really think it depends on the venue and what's going on. Family gatherings probably may not be an issue, but you know, again, family members could be positive and you not know it. So I think it just depends on what the situation is.
I'm going to let Dr. Torres jump in on this as well, because I'm sure he's got some thoughts, especially, you know, there's been that talk of we get into the warmer weather and this was supposed to be gone, and now we're not seeing that that's the case. And I know that it is really, really hot outside, so you're probably seeing people overexert themselves outside. Is there anything that you can add to that?
Well, I think that we should continue going outside, enjoying the weather, going to the lake, go fishing. It's the crowds that concerns us. You know, I think is the right time to go to a football game if everybody's going to be crowded once against each other. No, I don't. I think it's too early. We're still learning about this, and the more social distancing we practice and the measures that we have outlined so many times, I think they're beneficial. I think this is important to understand. I think one of your questions was, you know, is the rate of mortality and the spread of the virus, is this changing? If you read at the Georgia Department of Health website that's up for anybody to see, if you look at who's had COVID between the ages of 18 and 29, in the state of Georgia is 36,000. Out of that age group, only 24 have died. But if you look at over 80 years of age, in the website, it shows 6,320 individuals have contracted COVID. In that age group, 1,293 have died. Our older individuals, when they're exposed, even though they're at a lower rate, the mortality is very high. So it depends which numbers you want to look at. You know, for the young folks, they do pretty well. For anybody over 80 years of age, this is significant.
Okay. So, yeah, you were touching on that question about the mortality rate. I sent that to you earlier, so I'm glad you went ahead and answered that. Kathy, the other thing is we've noticed, you know, people are getting their test results back at different times. There's some that are getting them back right away. Some of them it's taking a lot longer. Can you give us a little bit more? Are we low on tests or what?
As far as the test kits, as far as Department of Public Health, we have plenty of test kits. We haven't gotten low, or we've not had any issues with that. I have understood from some of the other test kits to date, I have had issues with test kits, and I'm not sure what the issue was of that. As far as getting the test results back, there's a rapid test that you can do, which we don't have access to that, but our test that Public Health takes on the average about 4 to 5 days to come back. So.
Okay. All right. Well, anything else that I haven't asked that y'all would like to cover in today's chat? We still have, you can definitely ask in the comments below if you would like to ask our presenters here today. Here's your chance. We've got our local expertise here.
I would like to add and emphasize, we are still open for emergencies. We're not only taking care of COVID. We're, as a specialty, emergency medicine, we've been very concerned about the drop in numbers of individuals coming to our facility for chest pain, for shortness of breath, for bumps and bruises that occur in a daily life. Our numbers have dropped, and we worry because I don't think the incidence of heart attacks have dropped in our community or anywhere else in our country, and yet emergency department visits have dropped significantly. We're open. We're still taking care of those things. If you have signs of stroke, we are a certified stroke center where we can get you medicine quickly and get in touch with our neurologist partners to make sure the stroke does not mean permanent disability. So we are open for emergencies. That's what we're here for.
Thank you, Dr. Torres. And we do have a couple of questions here, and I'm going to pop one up first from our chamber chairman here. She asked, she'd be interested to hear what positive antibody test result may mean.
It means that you had it and you have antibodies, but it doesn't necessarily mean you're immune. I actually know somebody who had COVID early on, recovered, and has it again. So much for potentially developing the antibodies. So all that means is that you've had it. Doesn't not necessarily mean you're immune from it. I would suggest, though, if you have a positive antibody test, consider going to Shepherd Community Blood Center and donate your plasma, because that plasma could be used to treat some of our critically ill patients in the ICU. There's been good results with the plasma transfusions.
Great point. Great point. Okay, I've got another question here from Kelly Evans. The state is reporting low bed numbers. What's the status of Region G beds? Are hospitals on diversion?
Currently, our hospital is not on diversion. None of the hospitals today in Augusta are on diversion. There was some concern a few days ago about some of the numbers. I can't tell you what it is statewide. I can tell you, though, that we're seeing more patients in the hospital now than we did in the spring. We do still have bed capacity, but what's concerning is that the surge of numbers of patients that we're seeing that are having to be hospitalized, it's much more significant now than it was the spring. And I think that's a good reason why University Healthcare System made the decision to make Somerville a cohort facility for COVID patients. So they have the rooms set up, the staff all have all the expertise, and it's keeping other rooms open at the main campus and here at McDuffie open to take care of patients that are non-COVID. Like Dr. Torres said, we are open for business in the emergency department, and it is concerning that, I think people are scared to come to the hospital because, oh my gosh, I might get it. If you're having chest pain or other things and you would have gone to the emergency department any other time, you need to come in. We don't want to find you at home in a bad way.
Thank you, Bob. I got a question from Jerry Dunn off of YouTube. Thank you for the compliment. What are your thoughts on school starting up? Just your opinion. Anybody?
Well, my wife's a teacher in a neighboring county, and I know she's a little nervous. Kids for the most part do okay. Dr. Torres, chime in, because Dr. Torres is also a pediatric emergency specialist.
Oh.
But I think this, my wife teaches first graders, and it's hard to keep them from the noses running and touching everything on a normal day. So I think that's a little concerning. And just the fact that I don't think some school systems are mandating masks, some aren't. How do you social distance? What happens if you have teachers that are high risk? I would hate to be a school superintendent. That's all I have to say.
I agree. Okay, so we have another question. These questions are coming in. Mark Elliott, I've heard mixed reports about people getting retested after recovering from COVID-19. Should someone who has been symptom-free after experiencing symptoms get retested to make sure that they are healthy?
From my point of view, no. We still have a lot to learn about how long the test comes back positive for. It could be just 14 days. It could be 28 days. we still don't have the data. We don't have the data because this is still a novel virus for us. We have a lot to learn still, but we are seeing hard data that after the initial infection, there are folks that do get reinfected, but it's a much lower rate than those that have a new infection. In other words, if you've been exposed, you have 14 days to recover. From the IgG immunological studies, we're still trying to figure that out, because we're seeing folks that are positive, but they have no symptoms for an extended period of time. Those are the folks that we're asking, and Bob made a great point. Those are the ones that we're looking for plasma for those patients that are in the ICU. We know that is working really well. But as far as the test that we're doing to detect COVID, we don't know how long you're positive for. If you have no symptoms after 14 days, I will practice the principles that we will continue, social distancing, washing your hands, wearing the mask, but continue doing what you need to do. Work, interact with your family in a proper way, go outdoors, and support our local businesses. They need to survive as well.
Point. Thank you for adding that. Carrie Bridges, glad you're with us today. He says, this is great, informative session. Do you have any insight to the development of COVID-19 vaccines?
I just heard Cambridge University Oxford University in England has some promising first test results of their testing of a vaccine. I don't know, Dr. Torres, from your perspective, vaccines oftentimes takes a couple of years to kind of go through the testing process and validation process. So I am no scientist by any means from that point of view. I guess the question is, we don't know for sure how long we will remain immune from the virus once we get a vaccine. And we even see folks that get the flu vaccine still get the flu. It's about 45 to 50% effective anyway. So it's not going to be the cure-all or the guarantee, I don't think, that you're not going to potentially get this virus. Dr. Torres, do you have any thoughts?
Same with you. I'm not by no means a virologist or immunologist. I'm reading the news like all of everybody in America is reading and trying to figure out what is going to happen next. So I'm curious to see. We had an old immunologist that used to tell us about vaccines: never be the first, but never be the last to get it. Meaning that the testing phases need to go through. We need to see how effective it is, and I'm hoping that we do have a vaccine by next year.
All right, I've got a nice comment for from Dr. Limley.
Thank you, Dr. Lemley.
Thank you, Dr. Limley.
All right, I see a comment from Wesley Walker. Are there ways local businesses can better protect everyone while still remaining open and keeping their employees paid? Who wants to touch on that?
I would say wear masks whenever you're with direct contact. Wash your hands, and just anything you would do to protect yourself from the flu, that's what you'll do to protect yourself from COVID.
A lot of the retailers, at least I live in Evans, and I've seen, I'm not going to name the name, so I don't want to give them free advertisement, but are requiring masks to be worn. And I think that makes sense if you're going to be in an enclosed area, shopping amongst people. If everybody would wear a mask, again, it's no different than going to a family reunion outside or a public event or coming to the hospital. You're doing that to protect your neighbors. So I think businesses should mandate people wear a mask when they're inside their stores. It keeps their business open, it keeps people healthy, and it keeps the economy going. So I think that's just common sense.
I agree. This question is directed at Kathy. What's the process for getting tested?
If they're wanting to get tested through public health, they can call 706-721-5800, and they'll get to the call center and they'll get an appointment. with whichever site they would like to test at.
Kathy, give that number one more time.
It's 706-721-5800.
Great. Okay, that's all the questions I'm seeing right now. Let me make sure that I haven't missed anything. Ashley she posted again, wanted to thank you guys for your leadership and support. And I have to say, we are truly proud of what we have in our community. Y'all are local heroes to us, and we shouldn't just consider that during this pandemic, because you've been local heroes all along, and we're just now putting the spotlight to it. So we do thank y'all for all that you do, not just for our community, but all around. We are very thankful that we have such a great facility here with expertise like we have. And I see somebody, yes, local heroes.
Well, actually, I would like to intercede. We have a lot of local heroes. Our housekeeping, our security, our nurses, even our front clerks who are just sit there and receive our patients and greet them in a very, they have families too. They're worried about this as well.
Mm-hmm.
And they're probably more exposed than I am. By the time the patient gets to me, I already have an inkling of this may be COVID, or this may be a non-COVID patient. But the folks from the front to all the way to the back rooms, and to the nurses that work up on the floor that take care of the patients, and they take care of COVID patients day in and day out. They are truly the heroes as far as I'm concerned.
Yeah, I agree with that. If you pass by our sign, it says heroes work here. And from day one, when this first started, the team here at the hospital has just been outstanding. Again, it's been stressful. It's been nerve-wracking. It was kind of an unknown what this virus was going to be like. Everybody in the emergency department, they were kind of at the sharp end of the arrow there, and they've done a great job. Again, like Dr. Torres said, everybody in the hospital, all of our staff upstairs, our technicians, our housekeepers, everything, it's just been phenomenal. And our partners at the main campus in Augusta. We rely on them for their expertise. That's where our infectious prevention department is. That's where we have to ship our patients who are the sickest. And they've been phenomenal working with us and helping support us too to meet our mission here in the community.
Okay, well, while we're on talking about our local heroes, I've noticed some of our businesses have kind of stepped in and done the buy local, give local. And I know that y'all have been on the receiving end of being provided lunch or some kind of act of kindness. Do y'all want to kind of touch on that of, if somebody's wanting to do something, how can they go about it?
Well, first off, I want to thank everybody in the community who's been supportive of the hospital. And there have been several businesses who have brought lunches and dinners and just really kind of an outpouring of support for the staff, especially early on when this was all first kind of hitting us. And we had that MASH tent set up outside of our emergency department where we were triaging. And at that point, we really didn't know, we were really expecting the worst. And thank God we kind of weathered that storm, but it's ramping back up. And I appreciate all that. But I think the biggest thing I'd ask everybody in the community, businesses or individuals, wear a mask, sanitize your hands, wash your hands, take responsibility. This is a public health emergency. And by doing that, you're really helping us, because you're going to help reduce the number of patients and decrease those that need to be hospitalized. That'll be the biggest thing you can do for us.
Kathy?
I agree. That would really help, because that's what we're doing is testing. We're doing the case investigations, the contact investigations, and it's very daunting.
I can imagine. Well, with that, if they are going to provide you lunch, we ask that you certainly buy local and show that, on your Facebook page, and send it to us here at the Chamber. We want to give you a plug as well, that you're doing something for our local heroes. So Absolutely. That helps our economy. We never know what's going to happen tomorrow. So help support our local community. And that's all I have to say on that. So if there's not anything else, I think we are good. Thank you all for joining us today. And stay tuned. We're going to actually have another Chamber Connect. We haven't set a date for it, but we are looking to go on different issues throughout our community. Let me go ahead and get back to the full screen. Sorry about that. And so as you can see, our sponsor is up there now, University Hospital McDuffie, and I do thank them for sponsoring this program. They have been so wonderful to us, and we appreciate that. So with our next program, if you are a chamber member and you're interested in sponsoring one of these programs, and you could even get a 30-second commercial in the midst of it, and we can always work around that. So definitely call us here at the chamber, and we would love to have you as a sponsor for this program. So with all that said, we thank you for joining us today, and stay tuned for our next show, and we'll keep you posted. Goodbye, everybody.